Okay, so this is going to be the 12 lead electrocardiogram or EKG placement. First, we're going to go ahead and you're going to want to shave your patient's chest hair. If they're male, most likely they're going to have chest hair. And in the areas of where you're going to be placing these leads. So you're going to want to shave around the chest, here, down here for your modified or exercise testing, on the wrists for the resting, and in the inside of the ankles as well. Okay, next you're going to need to use your alcohol swab, sanitize the areas. And then a rough abrasive sponge to take the layer of dead skin cells off so that the leads will stick better. Okay, now we're going to go ahead and place the limb leads. Your first limb lead is the AVR. It's going to be going on the right side of your patient. For the resting, it's going to go on his wrist. AVL will be going on his other wrist. The ground will be going on the right ankle, the inside of the ankle. And the AVF will be going on the left ankle. Okay, now we're going to go with the chest leads. Your first chest lead is the V1. It's going to be located on the fourth intercostal space to the right of the sternum. So you're going to want to find the fourth intercostal space. There. V2 is going to be located on the fourth intercostal space to the left of the sternum. V3 will be located midway between V2 and V4, so we're going to do V4. It's going to be the fifth intercostal space at the midclavicular line. So go ahead and 1, 2, 3, 4, 5, and midclavicular line. And then V3 going in between those two. V5 is going to be the anterior axillary line and at the same level as V4. So, anterior axillary line. And V6 is going to be at the mid-axillary line and at the same level as V4 and V5. Okay. Now we're going to be able to hook up the leads. And okay, now we're going to be taking the leads and connecting to the electrodes. This is V1. V2. V4. V5 and V6. And for the exercise, or the modified limb lead, we're going to be taking the limb leads off of the wrist, and this one is your AVL. So it'll be located halfway across the left clavicle and the subclavicular fossa. So right about there. And your AVR will be halfway across this one in your subclavicular fossa. Your ground is going to be placed halfway across the, placed on the lowest right intercostal space, approximately mid-clavicular. And your AVF will be placed on the lowest left intercostal space, approximately mid-clavicular as well. And that's it for your 12 limb lead, modified and resting.